Let me bring in two senators at the center of the debate. Senator Kent Conrad, the chairman of the Senate Budget Committee, also Senator Jim DeMint, the chairman of the Conservative Senate Steering Committee and the author of a new book called Saving Freedom, We Can Stop America's Slide into Socialism.
Thank you.
You've got vivid rhetoric there, and you've also gotten into a bit of a war of words with the president in the last couple of weeks when you said the health care issue could be Obama's Waterloo and that his plans will destroy America's health care system. But his allies argue that the plan will provide real benefits to your state. And let me show you what they're saying, the House Energy and Commerce Committee, that the president's plan could provide tax credits for up to 92,200 small businesses in your state. It'll provide $648 million for doctors and hospitals in your state and get access for about 669,000 people who don't have health insurance now in South Carolina. They say you're standing in the way of what your state needs.
Well, they gave us similar numbers with the stimulus and promised our unemployment wouldn't go above 8%, and now in South Carolina it's over 12%. So the numbers are hard to trust, George. This is not personal against the president. I like the president, but he's out of control, and he's been leading a stampede of more spending and debt and taxes and government takeovers. He's taken a bad economy and made it worse. He used a lot of false promises and bogus numbers and panic to push through the stimulus. And the promises have not panned out. And now he's trying to use the same strategy on health care. And what I'm trying to do, and I think even Kent has had reservations, let's slow down and get this right. My goal is to protect the right of every American to make their own health care decisions. And if we can do that, we can come up with a bill.
Slow down and get it right. Is there any meeting in the minds here?
Look, the critical thing is that we do get this right. This is going to affect every American. Very few legislative initiatives affect every single American. And it's 1/6 of the national economy, so it's critically important we get it right. But that shouldn't be used as a pretext to kill it. I mean, Jim, I think, has been very clear. He wants to kill it. And I think that would be a tragedy because we've got a crisis here for the country. Not only are we spending $1 in every $6 in the economy, we're headed for a circumstance in which we'll spend $1 in every $3 in health care. Well, that'd be a disaster for families, for businesses, and the government itself. Let me get into that
because both you and President Obama have really said that the #1 priority has to be to get costs under control. And the president endorsed a proposal this week for an independent Medicare commission that would really look hard at and crack down on payments to doctors and hospitals. But the head of the Congressional Budget Office put out a letter yesterday where he said the savings, the 10-year savings for that proposal would be only $2 billion over 10 years. And he went on to say the probability is high that no savings would be realized. So do you have to go back to the drawing board?
No, because in the plan that we're working on, you know, there are 6 of us on the Finance Committee, 3 Democrats and 3 Republicans who have been given the responsibility to come up with a proposal for our colleagues. And in the effort that we're making, we've recognized that there would be savings in this area, but that they'd be relatively modest. That the 2 big drivers are delivery system reform. So we've got to copy the things. Well, we look around the country. What's working? The Mayo Clinic model, the Cleveland Clinic, Intermountain out in Utah. They are teams of doctors that are patient-centered, that share diagnostics, that share administrative staff. They save money, they get the best healthcare outcomes. That's what we've got to replicate all across the country. The second big driver is the income tax subsidy to healthcare. $2.4 trillion over the next 10 years. Virtually every economist that's come before us has said you've got to reduce that tax subsidy to health care to reduce overutilization.
Now, the president has taken that off the table, but an administration official is quoted in the Politico today saying that he is now open to taxing the Cadillac plans, he calls them. One of the examples they give is the Goldman Sachs partners have a $40,000 plan. You're saying tax those?
Yeah. I think we've got to. Again, virtually every economist that's come before us has said you've got to reduce that tax subsidy as part of an overall strategy to really contain costs.
What's wrong with that?
Well, I can tell a lot of these folks have not been in business. So you tax the insurance companies, it's going to affect the cost of every policy. This is not about the numbers. Republicans, including me, have introduced lots of health care reform proposals. I introduced a tax equity which would allow people to deduct the cost of their health insurance. The president and Senator Conrad voted against it. I had a proposal that would allow people to buy health insurance in any state, not just a single state monopoly. The president and the Democrats voted it down. I had a proposal that would allow individuals to use their health savings account to pay for a premium. They voted it down. They even voted against allowing small businesses to come together and buy their health insurance. So, George, what we've seen is that Republicans do want reform that will make health insurance more affordable and available. But the only proposals we're getting from Democrats is more government control of health care.
So what's wrong with the senator's proposals?
Well, the senator's proposal, the DeMint proposal, in itself would be a disaster. He has no insurance market reform. In fact, it's kind of a protection for the insurance, private insurance companies, the DeMint plan. In addition to that, it would force millions of people out of employer-based coverage onto some kind of government help. That could conceivably cost $2 trillion for the government. In addition, he's going to give you a voucher of $5,000 in 2016.
That's the tax credit.
Yeah. He's going to give you a voucher worth $5,000 when health care costs $20,000. That's in 2016. Doesn't sound like much of a deal to me.
Afraid he didn't describe it right. The healthcare freedom plan, George, that I introduced would not take anyone off of their current plans. It wouldn't bother people on Medicare. You keep your coverage, you have it work. What we do is give fair treatment to those who don't get their health care at work, and that would be a $5,000 a year health care voucher for every family.
But how about the point that most plans cost far more than $5,000?
Well, they wouldn't if we would allow interstate competition. They think we have to have a government plan to have competition. But the President and Senator Conrad have voted to maintain a state-by-state monopoly by insurance companies instead of allowing a national market for insurance plans. There are plenty of products out there that could get people insured for $5,000, and if we allowed employers to put money in a health savings account and let the individual use that to pay for a premium, people could buy more expensive policies. But we don't impact anyone who has insurance
Senator
now.
Conrad, let me bring it back to these bipartisan negotiations you talked about, because that really is the big game in town right now. To the Senate Finance Committee, you've got 3 Democrats, 3 Republicans, but a Republican, Senator Orrin Hatch, dropped out of the negotiations this week. And you've got a dilemma. Senator Chuck Grassley, the Republican ranking member in the committee, says he's going to need some guarantees that the deal you strike here is going to survive all the way to the president's desk. Yet you've got your own Democrats warning you not to give away the story. Chris Dodd in the New York Times this morning saying if they overstep the line in these negotiations, talking about his fellow Democrats, to bring 3 or 4 Republicans along, there will be a reaction among Democrats unlike anything you'll hear among Republicans. So how do you solve that dilemma?
You know, you got to keep putting one foot in front of the other and try to have a plan to propose to our colleagues that can win their support, Republicans and Democrats. Look, there are not the votes for Democrats to do this just on our side of the aisle. This is going to require
So it's just
Republicans
not possible to have a Democrat-only bill?
No, it is not possible. And perhaps not desirable either. We're probably going to get a better product if we go through the tough business of debate, consideration, analysis of what we're proposing. You know, it is so important we get this right and that it's sustainable. If I could just come back to Jim's point. A $5,000 voucher, as he has proposed, he says there are a lot of plans out there that have $5,000. Yeah, there are. But what are they? They don't cover much of anything. In fact, they work not to provide you coverage. That's why they only cost $5,000. And his plan is to provide you $5,000 out years from now, when the cost of health care will have gone up even further. So that really is not a serious option for American families.
Senator DeMint, is there a chance that these bipartisan negotiations can get broader Republican support? There are 3 Republicans talking with the Democrats in the Finance Committee. What is the broader pool of Republicans who are open to the kind of bipartisan compromise they're working on? Well,
Republicans want to protect the right of Americans to make their own health care decisions, to pick their own doctors and their own plans. We can do that, and I'm afraid the senator is not representing my ideas correctly, but if we could have a plan in a few weeks, George, if the goal was not a government takeover. We've never seen the government operate a plan of any kind effectively and at the budgets we talked about. This is about the most personal service that Americans have. We don't want to put a bureaucrat, as the president talked about the other night, he was talking about picking a red plan, or a red pill or a blue pill. He was accusing doctors of taking out children's tonsils just to make a profit. But he doesn't have the right respect for doctors and how the industry
You know, Senator
works.
Conrad, it seems pretty clear that one of the red lines that Senator DeMint is identifying here, at minimum, is that this idea of a public health insurance option, which matters so much to many of your Democratic colleagues, is something that's going to guarantee you limit Republican support to 3 or 4 or maybe 0 Republican senators. So are you telling your Democratic colleagues that that is simply not going to happen?
What I'm telling them is there is an alternative that tries to capture the best of both sides. I've put forward a cooperative approach. Cooperative business model is successful all across America. You know, Ace Hardware is a cooperative. Land O'Lakes is a cooperative. We have Group Health out in Washington that's a cooperative. It's not government run, not government controlled. It's membership run and membership controlled. And that is a model that would provide additional competition for for-profit insurance companies. In half the states in the country, there is no effective competition. One place where Jim and I probably can agree is more competition is a good thing. More choices for consumers is a good thing. And that's what we're trying to provide. Not a government-run system, a membership-controlled, membership-run that will provide additional competition.
What's wrong with that?
Well, the senator is talking about having a Fannie Mae or Fannie Med type organization in every state, a government-sponsored organization that decides what insurance you can have and what you can't have. That makes no sense when all we have to do is take these barriers away from interstate competition of insurance plans. We could have dozens and dozens of insurance companies competing for the business of my children and his children. We don't need the government to take this over.
You know, we're going to have to leave it there, but very quickly, Senator Conrad, are you going to finish your negotiations by August 7th?
You know, we're going to finish when we're finished, and we're going to do everything we can to get it right. We're moving with dispatch. We meet hours every day. We've got the best analysts in the country helping us. We'll be ready when we're ready.
Okay, Senators, thank you both very much. We're going to go straight